People living in some rural Wisconsin townships are facing what could be a life or death problem. They're struggling to find ambulance and emergency medical services for their community. We first reported on this last year when a private company said they would no longer be serving those areas. CBS 3's Natalie Grant reports this gap in coverage is getting some attention.
2021 posed a new challenge to residents in rural northwest Wisconsin. Great Divide Ambulance stopped serving the region on January 1st. To keep everyone safe, new programs had to pick up the slack, including the Ashland Fire Department.
If the volunteer services are struggling, that puts a bigger strain on the career services such as Ashland Fire, in that we're getting requested to assist them more and more, tying up resources from our community, lessens our ability to provide care to our community.
Lieutenant Matt Spangler attributes the strain to a lack of interested applicants. He says if more people wanted to become EMTs, this gap in service may not have been an issue.
A lot of these townships weren't able to get staff trained prior to the January 1st deadline that occurred, and were left in a bad position.
Wisconsin Senator Tammy Baldwin was shocked to hear about this issue during her trip to Mellon Thursday. She wants to get more funding to these rural townships, incentivizing people to be paramedics, even as a volunteer.
We've got to figure out a way to create greater incentive and greater support for those who work full-time and volunteer on top of that, so that they can have more robust departments that are really serving the community.
Despite the difficult position, she believes communities are working hard to make sure everyone gets the care that they need.
I hope that all Wisconsin residents can be assured that their communities are fighting to make sure they meet not only obligations, but serve in the spirit of neighbor helping neighbor.
According to Lieutenant Spangler, as of right now, all the townships are covered with EMS service, but more volunteers are still needed.